Tonight on Nation to Nation, Winnipeg police killed 3 Indigenous people in 10 days. A Manitoba organization wants an Indigenous police oversight board.
It would shift some of the thinking within the force around, because now they're accountable, a bit more accountable.
And when will rapid COVID-19 test kits be available for First Nations? Some say a few weeks, others say it may not be until July.
I think we have to wait for the company in order to come up with a realistic date of the production.
Friendship centers get $3.75 million to deliver services during the pandemic, but say it's not nearly enough.
That was that underfunded and competitive was very, to me, it was disrespectful.
Hello, I'm Todd Lamourant, and welcome to Nation to Nation. Winnipeg police have shot and killed 3 Indigenous people in the last 10 days. Southern Chiefs organization in Manitoba is calling for an Indigenous oversight body to investigate police shootings. But this is just one major issue unfolding in Manitoba during the COVID-19 pandemic. The Manitoba government is also looking to cut funding of children in care. As well, how are the province and feds responding to the COVID crisis? To discuss all this, I'm joined by Jerry Daniels, the Grand Chief of the Southern Chiefs organization. Thank you for joining me, Grand Chief.
Thank you for having me.
Now, I thought many years ago, we had an Aboriginal justice inquiry there in Manitoba. So why are Indigenous people still being shot and killed by Winnipeg police?
Well, I think we have systemic challenges that we have to confront, and we need to work with our partners in the justice system to create real, tangible changes that will shift the culture towards more of a collaborative atmosphere with the First Nations communities.
I take it that a lot of the suggestions that was in the Aboriginal Justice Inquiry have been ignored or forgotten. Well,
we've been pursuing restorative justice. We've been working with the justice officials. We've worked with the judges. We've actually been part of training some of them for cultural awareness, those kinds of things. We have a police force here in Manitoba, the Manitoba First Nations Police Force. We have many of our First Nations people who are part of the force, and so we're really looking to them and counting on them to help kind of change and hopefully shift the system towards a more collaborative, more more sincere approach to dealing with First Nations and the situation that we found ourselves in now, considering the colonial history. So that's what we're hoping to see, and maybe come out with a more independent body that could oversee and review some of the force's actions.
Yes, you mentioned you'd like to see an Indigenous oversight board. How do you think that oversight board would save lives?
Well, we think that it would shift some of the thinking within the force around, because now they're accountable, a bit more accountable to First Nations, the leadership, the communities, in the actions that they have taken. Policy can shift and change. Recruitment within the force can shift and change based on officers' conduct and the way that they approach First Nations, their attitude to First Nations. Those kinds of things, I think, are important part of how officers are promoted and the culture of the force as it stands now. I think that those kinds of things can create a lot of change.
On a bit of a different front now, you have a provincial government trying to cut funding to kids in care. What exactly is the Pallister government looking to do?
Well, they've instituted a block funding model. And they've also instituted significant policy changes, and they haven't really put a lot of funding into making that transition happen. So a lot of our agencies right now have not been given advanced preparation in order to look at how they would change their operations, in order to meet some of the financial barriers that are now being absorbed by the agencies. The agencies are carrying the brunt of this, so they take on the debt. The province has offloaded that, and so that's the challenge that we face right now. Our worry is that we may get overwhelmed by just the amount of First Nations children that we have to help and support, and because we're really shifting towards a preventative climate and environment, and not so much where children are being taken from their homes. We're really trying to keep children in the home. So a lot of that means that a lot of resources are being provided to help and support our families. And now we have a cap on that, and you know, the amount of cases that our agencies and communities are faced with, sometimes it could just be a great deal, given the many different issues that we confront, especially with the addictions crisis that we've been seeing, and now we're in an era of COVID-19. So a lot of those things we haven't really taken stock of, but we're working very hard at meeting those challenges. But it doesn't help when we have a province that doesn't give a good deal of notice when we're trying to make these kinds of changes, when we're trying to develop community-based regulations and law, and trying to structure those things so that our agencies are responsive to that, they're responsive to the communities, structuring the communities so that they can be supported. You know, our grandmothers, the housing needs that need to be there in order to keep our children in the community, all of the necessities in order for them to be safely taken care of in the communities and in the homes. So there's quite a bit of work that goes into this, you know, technical details, and we're always trying to look at how we can maximize the limited amount of resources that we have. But it doesn't help when governments are unilaterally making decisions without our participation.
Grand Chief, since January, Bill C-92, the federal legislation for child welfare reform, has been in place, and if we'd had a federal budget in March, which we haven't because of the pandemic, would some of these problems have gone away if that funding had been there, or would you still be in this battle with the province?
Well, the federal government hasn't answered that question. They haven't answered the question of, okay, if First Nations are now going to be given control through Bill C-92 of our citizens that are located off reserve, how does that rectify the financial situation with the province? As the province right now provides upwards to 60% of the funding for child welfare overall. So how does that help our agencies and our communities with our people who are off reserve, our children who are off reserve? So that's been a question that I've asked going back to when Jane Philpott was the minister. When she came here and she met with us here in Manitoba, she met with the chiefs, and I asked her that question. And the question and the way it was answered was that they would get to it, or it wasn't a clear answer. It wasn't very clear. But from what I've seen, is that they're hoping, or they're pushing really to have the province agree with the financial situation, and perhaps they will. We haven't gotten to that point yet. The province hasn't said that they wouldn't work with an agreement that the First Nations and the federal government could agree on. So there's different scenarios that could play out here, but whether or not it would have helped in the new budget, I don't think so, because we don't have an agreement. There's no agreement there, so it would have been status quo, you know, and so we would have been moving on an incremental basis, I think, and that's what we've been seeing with the federal government. It's very here and there, small, small development towards a First Nations controlled child welfare system. So we've been trying to move as quick as we can with the Southern Authority that we're in charge of at CFS or at SCO, and we've been looking at changing things like the birth alerts, those kinds of things. So just operational stuff we've been working on to try to bring down the amount of children that are being brought into care and supporting our mothers and our children.
Finally, I just want to briefly touch upon, earlier this week you appeared before the House's Standing Committee on Health, and you gave testimony. What did you think of that? Do you think at least those MPs on that committee heard what you were telling them?
Yeah, I think they were paying attention. They know how important the current situation is. I think that they want to make some change and make use of the limited resources.
What do you think is the biggest change you need to help you and your part of the province? Well,
I think there needs to be a great deal of equity brought to the table. First Nations, the funding that's being made available, less than 1%, just a little over half of 1% is being allocated to First Nations. Now that is a travesty. That's terrible. In a country that speaks of freedoms and is as rich as Canada is, the original owners of this land are being treated at a very unequitable way. And so you just have to look at the numbers and we're 5% of the demographic and we're funded at less than 1%. So, it speaks for itself.
And just to clarify, you were talking in committee that the government's given out about $113 billion, but Indigenous people are about $650 million. I think that was the point you made during committee. Yes,
that's the point. That's the biggest issue. We could talk about the principle, all of these principles and programs and service alert, all these different things that are a part of our societies. But the fact remains is that First Nations are being treated unfairly when it comes to Canada. We are at, we're considered, 0.1%, 0.5, of a percent. That's the reality. And I think that the government needs to be held accountable for that, because it's clear what they think when it comes to First Nations, and they need to treat us fairly.
Okay, Grand Chief Daniels, I want to thank you for speaking to me.
Thank you.
After the break, our regular COVID-19 segment with Indigenous Services. Welcome back. It's time again for our weekly COVID-19 segment with Indigenous Services. Once again, we have Valerie Gideon, Senior Assistant Deputy Minister for the First Nations and Inuit Health Branch, and Dr. Tom Wong, the Chief Medical Officer for Public Health at Indigenous Services. Both appeared earlier this week as witnesses before the House's Standing Committee on Health to explain how the department is responding to the COVID-19 crisis. And they now join me. Welcome to Nation to Nation.
Thank you.
Now, Ms. Gideon, I'm going to start with you. I heard from testimony that you gave that right now infection rates among First Nations are 0.01% compared to 0.09% among the general population. But how do you know that's truly accurate if you're relying on provinces to provide statistics? And what about urban rates of infection where identity isn't recorded?
So the figure that I was quoting yesterday in my speech to the committee was specific to tested positive confirmed cases among First Nations communities and provinces, so living on reserve, not meant to be representative of the entire Indigenous population, regardless of where they live in Canada. I'll turn it over to Dr. Wong to explain the data that does exist with respect to COVID-19 cases.
Thank you. That's exactly, the situation when, you look at the First Nations test positive living on reserve. That only, includes those individuals living on reserve, and that does not include other individuals who live outside of the reserve setting. But even with that, one can look at, the number, being relatively small, but we should not be complacent about that, because if we are complacent, then the whole thing can explode, and we don't want to actually do that. And so First Nations communities on reserves have been doing an amazing job in keeping this virus outside of the reserve, outside of the door, and so we have to shut the virus outside of the door and continue to do so. Thank you.
Ms. Gideon, again, during your committee testimony, you mentioned $10 million has been earmarked for 46 emergency shelters to support women and children fleeing violence. Is this just for because of the pandemic, or is this something that's going to be permanent?
We do have program funding for those shelters on an ongoing basis, but this is a supplemental amount that is specific to the capacity of these shelters to have increased public health measures in place, or also to support vulnerable households that they know of in various ways. So it is specific funding to the COVID-19 response.
Dr. Wong, again during your committee testimony, I heard you talk about rapid test kits that are being developed by an Ottawa-based company. You say they may be ready to send to First Nations in a matter of weeks. But last week at the Health Committee, I heard a civil servant from Public Works say full production won't be until July. So how many First Nations will get these test kits in a few weeks?
At this point, we depend on the information from the company. The company, if they can actually produce some boxes of these test kits in May, this is, the information that we have received at this point. Should the company not able to ramp up its production, then it could be later. Thank you.
So it may not, it could be in July, as Public Works said last week then.
At this point, I think that we are too early to speculate. I think we have to wait for the company in order to come up with a realistic date of the production.
Now, Dr. Wong, you also mentioned training needs to be done on these rapid test kits. How long will that take, and how will it be done if a nurse, for example, is working up in a remote nursing station?
We are working with the National Microbiology Lab in Winnipeg, as well as the provincial laboratory system, in order to provide that kind of training. And training is done remotely through video conferencing and through Skype and other means as well. There will be manuals that will be circulated to nurses and other health professionals at the health facilities in order to facilitate the training. The training can be done the same day. And of course, in addition to the training, we need to work with the laboratory systems in order to set up quality assurance and quality control, so that when a test is positive, then it's positive. When the test is negative, it's accurately depicted as negative.
Ms. Gideon, immediately following your testimony was Jocelyn Formsma of the National Association of Friendship Centres. She indicated the $3.7 million that will be spread around dozens and dozens of urban organizations won't go far. How easy will it be for friendship centers and other organizations to get additional support if they need it?
Well, we do have weekly discussions with Jocelyn Formsma of the National Association of Friendship Centres, and actually my colleague Mary Kaplis was just on a call today with the network of friendship centres to hear firsthand about the excellent work that they are doing, in addition to the challenges that they are facing. There are other sources of funds also that friendship centres have tapped into. Some of them are provincial, and they are many of them continue to keep their doors open in order to serve their clients. So we will continue to have those very regular discussions and partner on things like customized communication. We are talking about training as well, additional training for workers in urban centers, for instance, to help support some of the public health measures.
When we speak about challenges, again, Ms. Formsma suggested there's the age-old problem of falling through the cracks while provinces and federal government square off over who is responsible for urban people. I suppose what can be done during this crisis to make things work more smoothly?
Well, I do think communication and collaboration is fundamental. In a discussion that I was having with representatives this morning, they identified a challenge in a particular city. I was able to contact a provincial official at a senior level to speak to them about that particular challenge so that we can help to coordinate response. It's very difficult to anticipate exactly which urban Indigenous communities may be affected. And so it's a continuous discussion and dialogue. And so, we will troubleshoot together. We will support service delivery organizations to the best possible ability that we have. We do have ongoing weekly, if not daily, discussions with our provincial territorial colleagues that are also adapting their response efforts to meet the needs, particularly where COVID-19 cases are rising.
Are you suggesting that after all these weeks, the message is finally getting through to provinces to react more quickly to requests?
I think everyone has established stronger and more effective mechanisms for communication and have adapted their response efforts and will continue to do so. I think that there's been a pretty rapid evolution of the COVID-19 situation in Canada, and I do believe that governments have reacted very quickly and swiftly, but that they are learning about emerging needs and service delivery gaps, and we will respond in a coordinated way across Canada, across governments.
Okay, Ms. Gideon and Dr. Tom Wong, I want to thank you again for speaking to me.
Thank you.
Thank you.
We'll have more after a short break. Welcome back. As I've mentioned before, the House's Standing Committee on Health met by video conference earlier this week, and the subject was Canada's COVID-19 response to Indigenous people. One area of conversation was around off-reserve and urban individuals, and are they getting the help they need? $15 million of the $305 million Indigenous Community Fund is set aside for urban organizations. Of that $15 million, $3.75 million is to be portioned out to just over 100 friendship centers. Witnesses from the National Association of Friendship Centers said that's not enough.
We certainly appreciate the support, but we know that these funds will not last long, and we welcome the opportunity to work with the government to seek additional supports for friendship centers.
Gary Vidal is the conservative critic of Indigenous services and asked Jocelyn Formsma a follow-up.
Could you please just elaborate a little bit? I know you spoke to it a bit in your presentation, but just elaborate a little bit more on how maybe the underfunding of urban Indigenous organizations during this pandemic puts Indigenous people in urban centers at greater risk.
I've had executive directors say that they've been sleeping overnight in the homeless shelter because they have lack of staffing. We've had people that said we had a 25% increase on requests to our food bank, and we ran out of food in an hour. We haven't been able to get access to some of those personal equipment.
Later on, Formsma talked about the toll on staff who are still working.
Because now we're getting to the point where in week 6, the staff's getting exhausted. We're hearing so much from our staff saying, we're tired, we don't know when this is going to end, we don't know when we're going to get help, we're doing the best that we can, we don't feel like we're doing enough.
Witnesses did say there was some extra funding here and there, from the Vancouver Foundation, for example. But as for the provinces, only Ontario is providing funding friendship centers can access.
Knowing that you have 100 organizations to try to get resources to on the ground, the fact that there was a structure that was that underfunded and competitive was very, to me, it was disrespectful.
Well, that's our show for this week. I hope everyone is staying safe and not too bored. I know there's only so much TV I can watch and video games I can play. Anyway, I'm Todd Lamoran, and thanks for watching.